Hi guys, this video will be about the motility disorders of esophagus. We will be discussing Achalasia Cardia and GERD. So, the motility disorder can involve the upper sphincter, body and lower sphincter of esophagus, and there can be hypermotility disorder and hypomotility disorder. Hypermotility disorders are cricopharyngeal spasm, diffuse esophageal spasm and nutcracker esophagus, while hypomotility disorders are Achalasia Cardia, GERD, scleroderma and amyotrophic lateral sclerosis. Coming to the hypomotility disorder, Achalasia Cardia and GERD. So, Achalasia Cardia is due to absence of peristalsis in the body of esophagus. So, there is absence of peristalsis and also high resting pressure and failure to relax in lower esophageal sphincter. So, there is absence of peristalsis in the body of esophagus, and in the sphincter, the lower esophageal sphincter is having high resting pressure and it failed to relax. So what are the symptoms? There will be dysphagia, and the dysphagia is more in liquid than in solid. And this is the reverse of malignancy and strictures, where dysphagia is more towards a solid. But in case of Achalasia Cardia, the dysphagia is more in liquid than solid, and there will be also regurgitation, especially at the night. So the symptoms are dysphagia and regurgitation. For the diagnosis, we will do barium swallow, and in barium swallow, what we will get? We will get a dilated esophagus with narrowed rat tail or bird beak appearance. So we are getting a bird beak or rat tail appearance. Okay, and then if we will do manometry, we know that the lower esophageal sphincter is having high resting pressure, and that's why it failed to relax. So in manometry, we will get high lower esophageal pressure and low body pressure. The body will be having low pressure. Now coming to the endoscopy, we will do to exclude strictures and carcinoma. So the treatment is modified Heller's operation, that is the myotomy of the lower esophageal sphincter or lower narrowed portion. We are doing the myotomy, that is known as Heller's operation. We can also do forceful pneumatic dilation for unfit people. So this was all about Achalasia Cardia. It is due to the absence of peristalsis in the body and high resting pressure in the LES. Symptoms are dysphagia more towards liquid and regurgitation. Diagnosis with barium swallow, we will get bird beak appearance, manometry high LES pressure and endoscopy to exclude strictures and carcinoma. Coming to the treatment, we can do modified Heller's operation, which is the myotomy of the lower narrowed portion, and forceful pneumatic dilatation for unfit surgery. Now coming to GERD, that is gastroesophageal reflux disease. So here what has happened is the LES function is decreased. The lower esophageal sphincter is not doing its function. So what happens is this acidic substance in the stomach will get into the esophagus and cause substernal pain, heartburn and regurgitation. So this can mimic that angina pain. So there will be substernal pain, heartburn and regurgitation. So what are the other causes? First one is the less LES function. GERD can also be caused due to pregnancy because the abdominal pressure is high, so the contents can go out. Hiatus hernia, scleroderma, smoking and alcohol. Then also the drugs like anticholinergics, beta blockers and calcium channel blockers, which will relax the smooth muscles. So pregnancy, hiatus hernia, scleroderma, smoking, alcohol and drugs like calcium channel blockers and anticholinergics. Now coming to the treatment, we will tell the patient to head of the bed should be elevated. So while sleeping, elevate the head and sleep. And there should be no food before 3 hours bedtime. Then they can use antacids and drug increasing the LES tone like metoclopramide, H2 receptor blocker like cimetidine, ranitidine, and avoid the smoking, alcohol, caffeine, chocolate, mint and carbonated drink. And also we can do anti-reflux surgery like Nissen's fundoplication. So head elevation, no food before 3 hours. Then antacids, drugs increasing the LES tone like metoclopramide, H2 receptor antagonist, avoiding smoking, alcohol, caffeine, chocolate, mints, and anti-reflux surgery like Nissen's fundoplication. Now, what are the complications of GERD? So, there in the esophagus, there can be esophagitis, strictures, and also Barrett's esophagus, which is the squamous metaplasia into columnar cells. It is a precancerous condition. So, esophagitis, strictures, and Barrett's esophagus. In lungs, there can be aspiration pneumonia, chronic cough, asthma and bronchiectasis. Okay, in larynx there can be posterior laryngitis and that can cause the hoarseness of voice, then granulomas and ulcers, laryngospasm and also carcinoma. In ear there can be otitis media and also globus hystericus, that the feeling of some swelling in the throat can also be there. So esophagus, esophagitis, strictures, Barrett's esophagus, lungs, aspiration pneumonia, chronic cough, asthma, and in ear there can be otitis media and miscellaneous globus hystericus. So this was all about the motility disorders of esophagus. Hope it was useful. Thank you.